Hello, this is Dr. Elaine Ferguson. I believe one of the most meaningful ways to manage the healthcare crisis that has been going on for the last 20 years is to incorporate a holistic approach to health as the foundation of our healthcare system. In reality, we have a disease diagnosis and treatment system, not actually a health caring system. One that has made great contributions in the treatment of acute traumatic illnesses as well as infectious diseases, but it ineffectively manages and actually suppresses the symptoms of diseases rooted in chronic emotional distress, lifestyle choices, nutrient deficiencies, and lack of adequate sleep. Would you think about this possibility for a moment? What if there was a new treatment that in research and clinical trials demonstrated its ability to not only improve healthcare outcomes in a number of illnesses, speed up post-surgical recovery, reduce unnecessary procedures, decrease medical costs, and improve patient satisfaction? And what if it has a significant bonus in which patients experience more happiness, were satisfied, more confident, felt less isolated without any side effects? Believe it or not, there is a treatment approach that has in fact demonstrated these qualities. Why haven't you heard about it in the media or had an introduction by your physician to this powerful approach? Because the research has been overlooked by most physicians for many, many years. Fortunately, mind-body therapies are making inroads into the medical establishment. Although emerging evidence during the past 30 years clearly indicates that psychosocial factors directly influence the body's function and health outcomes, medicine has failed to expand beyond the 16th century biomedical model due to the ingrained and limited thinking of the profession. Research suggests that psychosocial factors from emotional states including depression, behavioral dispositions such as hostility, and psychosocial stress can directly influence both physiology and health outcomes. And conversely, so can positive states of health. Evidence from several lines of research, however, also suggests that despite seemingly widespread acknowledgement and support for the importance of the biopsychosocial model, these factors are continuously overlooked or ignored in many clinical encounters and are frequently underemphasized in medical education. While the reasons underlying the failure of medicine to move beyond the biomedical model are quite complex, the lack of exposure to the evidence base supporting the biopsychosocial model may in fact be one of them. Also, while studies have shown that evidence of the effectiveness of a given therapy is frequently insufficient to change clinical practice, the generation, synthesis, and communication of research findings continue to be central tasks for evidence-based medicine. However, medical research studies have emphatically determined that mind-body therapies in the treatment of numerous illnesses improve outcomes. There is now considerable evidence that an array of mind-body therapies can be used as effective adjuncts to conventional medical treatment for a number of common clinical conditions. In a retrospective study, researchers assessed the impact on healthcare utilization and costs of a multiple component prevention program, MVHA. The components included meditation, diet, and exercise. They were compared to Blue Cross Blue Shield Iowa statewide norms from 1985 through 1995 and to a demographically similar group such as people with the same age, gender, socioeconomic status. The research found that the 4-year total medical costs in the MVAH group were 59% and 57% lower than those in the norm and control groups, respectively. The 11-year average was 63% lower than the norm. The MVAH group had lower use of medical services and costs across all age groups and for all disease categories. Hospital admission rates in the control group were 11.4 times higher than those in the MVAH group for heart disease, 3.3 times higher for cancer, and 6.7 times higher for mental health and substance abuse. The greatest savings were seen among MVAH patients over 45 years of age who had 88% fewer total patient days compared with control patients. The results confirm research supporting the effectiveness of MVAH for preventing disease. Their evaluation suggests that MVAH can be used safely as a cost-effective treatment regimen in the managed care setting. Preparing for surgery. An important component of psychological preparation for surgery involves giving patients positive psychological suggestions and imagery. In a randomized, placebo-controlled, double-blind clinical trial, 335 patients were given one of 4 different audio tapes to listen to before and during surgery. A placebo group listened to a tape with neutral white noise. Dr. Elizabeth Devin, a professor at the University of Wisconsin School of Nursing in Milwaukee, analyzed 191 different scientific studies in which surgery patients were taught simple, easy-to-use mind-body techniques. She determined there was an average reduction in the length of hospital stay. The patients were discharged on average a day and a half earlier than other patients who did not participate in the imagery program. The analysts found also faster recovery from surgery, fewer complications, and reduced post-surgical pain. Other studies have found reduced utilization rates for outpatient medical services as well. For example, in one study, 109 chronic pain patients participated in a 10-session outpatient group mind-body program. They experienced a 26% reduction in total monthly clinic visits for pain management after the first year of the program. Thank you for listening. This is Dr. Elaine Ferguson at www.howtogetwellfaster.com. Please visit our website for more information about mind-body health, as well as our upcoming products that will help you to get well faster. Thank you and have a great day.